So before I get to the engineering side of things, I'll just walk you through a quick case example here of a 49-year-old lady who had received a metal hip replacement. She reported to the surgeons with quite a lot of pain around her hip, very high levels of metal measured in blood samples taken from her, and clear evidence of quite a lot of bone loss and muscle loss on medical imaging. So it was clear this patient, this lady, needed a revision operation and needed one quite quickly. And just to touch on, so we know the reasons for this. It's a lot of the cases seen at the RNOH are of patients that have received metal cobalt chromium hip replacements in the past and have suffered some of the consequences of the toxicity surrounding them. So these are patients that have, in many cases, had several repeat operations before they come for treatment at our tertiary referral centre. So CT scan was taken of the patient's pelvis and reconstructed in 3D, and the pelvis itself segmented and separated from the model, and it was very clear and as you can see on the image on the right, that there's a big hole where the acetabular cavity should have been. So clearly, a normal-sized implant, a hemispherical acetabular cup, would not fit into this patient. So engineers took the CT scan and from one of the manufacturers and designed an implant to fit the shape of the cavity of the acetabular defect that was left behind. And there's always some back and forth between the surgeons and the manufacturers to get the design right and things like screw positioning, for example. So this implant was, of course, then printed in 3D printed in titanium, ready to be implanted. And I think, from my perspective, this is really where the big advantage of 3D printing comes in orthopedics. It's the ability to manufacture implants with custom, complex geometries for patients, and also the ability to control surface porosity on the bone-facing sides. Although you'll see in later slides how much variability there is between different manufacturers. I'll skip past this. This is the operation itself happening, but I'll save you all the blood and guts there. But essentially, operation took place, implant was put in 6 months post-op. Patient was walking without support, very good range of movement, and importantly had no pain. And this is the lady herself walking, as you can see, very comfortably. All thanks to this technology, layer by layer, from titanium powder.